My name is Wendy, and I'm a registered psychiatric nurse, and I work at the Regina General Hospital. When we see youth come into the hospital, they're in a crisis situation, acutely suicidal, psychosis, just inability to cope at home.
A typical admission to the adolescent unit is between the ages of 12 and 17. They feel like that there's no place left for them to go, and they need some immediate and emergent help.
Social media, and I'm not too sure what to do about it anymore.
I am aware that there are suicides that happen, as early as 10 years old. When it comes to youth mental health, we often don't intervene early enough. We are in a crisis. We are not dedicating enough resources and support to our youth in Saskatchewan.
My name is Barrett. I live with anxiety and depression, and I've been living with this since I was 14 years old. I felt myself slowly pulling back from things, and my anxiety became the only thing I could focus on. It felt like my stomach was always churning, my legs would go kind of numb. On the darkest days when I didn't feel like I could talk to anyone, it would have been nice to know that there were people outside of my family and close friends that I could talk to.
Have 10 seconds to choose. My name is Brett. I'm a grade 7A teacher in Regina, Saskatchewan. I've seen a significant increase in anxiety among students, and it does really isolate kids. Students and youth today have a lot of issues coming forward with their anxiety because there's so much stigma that surrounds it. If you break your arm, you get a cast. Everyone wants to be the first person to line up to sign that cast. They want to say they helped you heal in some capacity. They want to contribute to your wellness. If you have depression, anxiety, or if you're crying or alone, nobody wants to touch you with a 10-foot pole because for some reason, it's been completely stigmatized, and students don't know how to deal with that.
I didn't talk about what was going on because I was embarrassed. I felt like I was the only one that felt like this, that I was an isolated situation.
My name is Alex. I'm in grade 8, and I am 14 years old. Depression, anxiety, stress, those are all things that happen to a lot of different people, so it's definitely something that is just as serious as some kind of physical health. We worry about intelligence, appearance, because in school, people are always comparing marks, anything like that. Someone posts something on Instagram, and then they're worried about likes, what people are gonna comment on. So I think that almost adds a certain amount of pressure. They're worried, what are people gonna think of me? What is the first impression that I'm making?
This generation is facing challenges like no other generation. We think there are a number of factors contributing to the increase in anxiety and mood disorders that we're seeing in children and youth. Technology, the amount of screen time kids have, the amount of pressure to succeed academically. Life is full of challenges, and what our kids lately are not learning to do is to cope with those challenges. And that's why anxiety can turn into an anxiety disorder, into depression.
If youth are left untreated, the illness will progressively get worse.
Some kids do self-harm, which can take the form of cutting. Some kids act out and become more difficult to manage at school and at home. So there's kind of a wide range of things that can happen, all the way to the end of starting to have suicidal thoughts and ideation and to actually completing a suicide. There's still a stigma around mental health. It isn't treated the same way as physical health.
My name is John. I'm a registered psychiatric nurse and registered nurse in Saskatchewan. I've counseled youth on issues from anxiety and depression to grief and loss. I've worked different areas of the province. Communities that tend to have higher rates of suicide, you'll notice a lot of the social determinants of health are impacted and impact suicide behaviors. Some of the social determinants of health that would impact mental health would be things as basic as housing and safety, for example. There's places in our province where social and cultural connection has been severely impacted through various things in the past. Once youth do come forward and seek help from a variety of mental health professionals, from registered psychiatric nurses to social workers to addictions counselors, sometimes accessibility can be a problem due to distance from services, staffing, or just the needs from the crisis in that community.
When children and youth come forward seeking help, there aren't enough resources in the schools necessarily to address all of those needs. There could be anywhere between 6 months to a year waiting, depending on what kind of supports that child or youth might actually need.
We know that early intervention is so necessary or important in the road to recovery. The earlier there's intervention, the better the prognosis.
One of the things we've done in our classroom is create a conversation around mental health. An open and honest conversation about how we're feeling and the things that can be done to impact the community and students themselves in a positive capacity.
The focus of our campaign this year was talking about our vulnerabilities, talking about what we're insecure about, and how it is hard to talk about that because we try and ignore those things.
They've reacted very, very positively. One student in my classroom, Alex, he's done a speech in front of 260 to 80 people at a mental health gala.
We were really focusing on making sure that everyone knows that it's okay, that we feel this way.
He got up to talk about why it is important to be a future leader and support one another, and why it's important to destigmatize mental illness.
If we're going to decrease stigma moving forward, youth need to be leaders in this.
So we're working on our circle of well-being. I facilitate a mood disorder peer support group, which is open to all ages, youth, young adults, and 18 plus.
I was anxious to go to the group for the first time. I got to listen and connect to all these different people that I've never met before and realize that we have something in common. Knowing that there's other people out there with similar experiences, the isolation isn't as intense. The value of going to that group is astronomical. In the last 5 years, my life has changed dramatically. I have a full-time job. I wake up in the morning feeling better about myself. But looking back, I wish it would have happened 10 years earlier. I would like to see more peer groups, more community involvement, talking about it in school, and have ways for the kids to reach out.
I believe that our education system needs to more directly address the issue of mental health.
The collective we within the province really need to come together and take a look at mental health like we would physical health.
I feel the way forward with our youth in Saskatchewan is that focus on early intervention, teaching kids, youth, some basic coping skills early on, those skills that then they can take with them throughout their life.
And most importantly, the positive communication, the way we inspire each other and work together as a team. It's that teamwork. In my career and my life, I've recognized that mental health is not merely the absence of mental illness, it's quality of life.
3, 2, 1, cheese!
It's doing things that are pro-social and assist yourself, your community, and your family.
The outcomes will be better. The outcomes for the individuals, the families, the province, the hospitals that will improve.
It's important that we have a balanced skill mix of professionals that are available, ready, willing, and able to support youth when they do come forward.
Really, we need all of the mental health professionals more accessible where the kids are, and the kids are in the schools, and families are in the schools. If we actually have some early intervention that is effective for the majority of the kids, that then there would be the resources available like registered psychiatric nurses, psychiatrists that are in the health system for those more specialized cases who need more in-depth support. You may not know someone personally, but it absolutely affects everyone. There are children out there in your neighborhood who are struggling. There are families in your neighborhood who are struggling.
It doesn't discriminate, it's anyone. You could be poor, you could be rich, it doesn't matter.
Early intervention of mental health can be a lifesaver because we can assist them in saving their quality of life or literally saving their life.
If we are actually a society that comes together, this should be important to everyone.
Youth mental health matters because they are our future.